Now let us see the composition of blood. As I told you, it's a heterogeneous medium, having both solid phase as well as liquid phase. The solid phase is entirely constituted by the blood cells. As I already told you, the erythrocytes, leukocytes and thrombocytes. What is the fluid phase of the blood? It is entirely composed of plasma. You know the percentage of plasma in the volume of blood? It forms 55%, 5-5. And the remaining 45% is composed of your blood cells. Now, how to find out the percentage of blood cells and the plasma? There is a very simple method. We can estimate in a lab setup by measuring the packed cell volume, or otherwise called hematocrit. What are the ways by which we can measure this packed cell volume? You need certain basic instruments for that. Number one, you need a Wintrop's hematocrit tube. You need an anticoagulated given volume of blood. Number three, you need a centrifuge. Now let us go into the steps or the procedure by which we are going to estimate the packed cell volume or hematocrit. You can see the procedure or the steps in the given animation. You should take the Wintrop's hematocrit tube and fill the anticoagulated blood from bottom up. You can use a long pipette. We call it as Pasteur pipette. So fill the Wintrop's hematocrit tube from bottom upwards by drawing the pipette as the blood is getting filled. Of course, you should take utmost care to avoid air bubble while filling it. So once we get the completely filled Wintrop's hematocrit tube, which is of course anticoagulated venous blood, the anticoagulant which is the most ideal one is the double oxalate. It's a mixture of potassium oxalate and ammonium oxalate. You may be wondering why we are going for this specific double oxalate mixture as an anticoagulant in this procedure. The reason is because this double oxalate will preserve the normal size and shape of RBC. This is the reason why we are so choosy towards this double oxalate mixture. Once the Wintrop's hematocrit tube is completely filled, you can centrifuge it in a centrifuge at a speed of 3000 revolutions per minute for 30 minutes. So after 30 minutes, you can take out this Wintrop's hematocrit tube. As you see there in the diagram, you can see there are different layers. Of course, the bottom layer is formed by RBC alone. That's why it will be reddish in color. Above that, a few millimeter thickness, you get a Buffy coat, which is entirely formed by WBC and platelets. What is there on the top as a clear fluid above? It is nothing but plasma. You can see the normal color of the plasma which is formed above. It is straw yellow in color. That is the normal color of plasma because of the bilirubin there. If you closely examine the color of the plasma, we can pick up certain abnormalities. Suppose the plasma which is formed above is reddish in color. It shows that the RBCs are getting hemolyzed. For example, in hemolytic anemia, you will be getting a reddish tint on this plasma column. If the person is jaundiced, you will get the plasma more deeply yellow or lemon yellow in color. In excess lipid, like lipemia, the plasma column will be more whitish in color. So the color of the plasma which is formed as a supernatant layer, it gives you a lot of clinical clues. Now coming to the RBC column formed at the bottom. By looking at the calibration of the Wintrop's tube, one can easily say that it forms around 45%. Above that, I told you a few millimeter of Buffy coat. This Buffy coat also can be used clinically for many purposes. If you want to have a smear of WBC alone, one can take this Buffy coat by using a pipette, and make a smear on the glass slide. From that, you can easily study the morphology of WBC, including its number. Some abnormal WBCs like premature cells, if they are seen, you can even make a diagnosis of leukemia. By looking at the RBC column, its height, we can have a rough judgment about the number of RBCs. If the column is more than 45% or more than 50%, you can make a diagnosis of polycythemia or increased RBC count. If the RBC column is shorter, less than 40%, the person is suffering from the other side of the spectrum, that is anemia. Of course, the further detailing of anemia should be done by using different tests. So, hematocrit will give you a rough idea about the nature of plasma, the height of Buffy coat, and also the height of RBC column. If the height of Buffy coat is excess, you can make a rough judgment about the number of WBCs. Of course, in leukemia or in blood cancers, the Buffy coat layer is much more thicker.